Hello, my dears. Are you ready for more options to reduce your risk for a heart attack? As you know, I cover every category of options and I present them all with great enthusiasm. The way I see it, the more options you have, the better. And I don't think the category matters as much as meeting your needs does. So I deliver as much information as I can to enable you to meet your needs. We're working our way through an entire unit on heart attack. In my book, whether you have the first edition or the second edition, it is chapter 28. And I've already covered the categories of diet, lifestyle, vitamins, minerals, and supplements, herbs, and hormones for reducing your risk for a heart attack. That means there's only one category left: non-hormonal medications. So that's our topic for today. And it's in the section of chapter 28 on non-hormonal medication options. This video is important because you never know which options you'll need to consider for lowering your risk of a heart attack. And the more you know about all of them, the better off you'll be. The scenario for a whole lot of women at the time they become postmenopausal is one in which they're a bit overweight and gaining more. Their cholesterol studies are less than ideal, often indicating a high risk of heart attack. They want to change their diet and lifestyle habits to lower the risk of heart attack, but they know that's going to take time, persistence, and determination. They already use the vitamins, minerals, and supplements that can help. Their blood pressure is a bit high, and they don't necessarily want to take HRT, or they take HRT, but their heart attack risk is still high. And their doctor says that they really need to consider a lipid-lowering medication, regardless of any other measures, just because they need to make a big difference quickly. If you found yourself in such a scenario, would you know everything you need to know in order to make a wise decision about whether or not to take a lipid-lowering medication? Or would you feel the need to go to the internet and consult Dr. Google? The vast majority of women would be on Google in a heartbeat. But Dr. Google is so inadequate and inaccurate. And that's why you should pay attention to this video now. I'll save you a lot of head scratching. There are three basic categories of non-hormonal medications for lowering your risk of heart attack. They are the statin drugs, aspirin, and blood pressure medications. So I'll go through each of these and teach you the basics with which you can find to tailor the details of your personal situation. And we'll start with the statin drugs. Statin drugs are the gold standard for lowering one's risk for a heart attack. The first thing you need to know about them is how they work to accomplish that goal. Back in video 162, I taught you that your body makes cholesterol. And statin drugs work in one of two ways. First, they stop the production of cholesterol in your body. Second, they help you break down and absorb some of the lipid buildup in your heart arteries. As a result, statins lower your total cholesterol, lower your lousy LDL, lower your triglycerides, and raise your good HDL. And by doing this, they stabilize the lipid buildup in your arteries so that it doesn't get worse. Now, in so doing, they decrease your risk of a heart attack. I guess you could say they sort of mend a broken heart. These drugs have been around for a long time. You probably would recognize a few of their names. Here's a list of the statin drugs. There's Lipitor, Lescal, Mevacor or Altocor, Livalo, Pravachol, Zocor, Vytorin, and Crestor. Recognize any of those? Of course, mending a broken heart is not an easy job. And nothing is magic. So these statin drugs do not completely erase your risk of a heart attack entirely, but they sure do work well to lower it. How well do they work? Well, they decrease your risk of heart attack by an average of 25 to 35% in general, and by as much as 60% for some people. Those are pretty significant decreases. Put another way, statins prevent one heart attack in every 50 people. And put even another way, statins lower cholesterol by an average of 1.8 millimoles per liter. They are so effective that statins are the most prescribed drugs in the United States and in many other countries. Most statins consist of a pill that you take by mouth once a day. And you can take some statins any time of day. Others require you to take them in the evening. So you might be wondering how you know if you should take a statin drug. Do you remember what I've taught you about guidelines? Almost everything in medicine has guidelines, and statins are no different. When it comes to the guidelines for taking a statin drug, if you meet any one of the following situations, your doctor may recommend a statin drug. 1, if you've been diagnosed as having any kind of heart disease. Now this means that you've had chest pain, or it may mean that you've already had a heart attack or a stroke. 2, if your lousy LDL is greater than 190 milligrams per deciliter in the US, or greater than 4.9 millimoles per liter in Europe or Canada. 3, if you are between the ages of 40 and 75 with diabetes and have a lousy LDL that is between 70 and 189 milligrams per deciliter in the US, or between 1.9 and 4.1 millimoles per liter in Europe or Canada. And 4, if you are between the ages of 40 and 75 and you have a lousy LDL of greater than 100 milligrams per deciliter in the US, or greater than 2.6 in Europe or Canada, and you have a greater than 7.5% risk of having a heart attack in the next 10 years. Now, you know that everything has risks. As with everything in medicine, your doctor's job is to weigh the benefits of taking a statin drug against the risks of taking a statin drug. And you should only take it if the benefits outweigh the risks for you. Everything is about how these benefits and risks affect you, and no two women are alike. Now, everybody focuses on side effects, but side effects and risks are not necessarily the same thing. Risks are more profound than side effects. Risks are the big ticket items that you incur in order to reduce your risk for something else. For example, by taking estrogen to reduce your risk of heart attack, osteoporosis, and Alzheimer's, you increase your risk of uterine cancer. Side effects are more minor. Side effects are the nuisances that you have to tolerate in order to gain the big benefits of the drug. So a side effect of taking estrogen is breast tenderness. So let me tell you about the side effects of a statin drug. Every medication has side effects. Side effects are things that may occur. Most side effects occur in only a small percentage of the people who take the drug, and most drugs have mild, common side effects. Some have uncommon, more serious side effects. So here are the side effects for the statin drugs. The mild, common side effects include headache, difficulty sleeping, skin flushing, muscle aches, tenderness or weakness, drowsiness, dizziness, nausea or vomiting, abdominal cramps, bloating or gas, diarrhea, constipation, and skin rash. Less common side effects include memory loss, mental confusion, a high blood sugar, which occurs in about 1 out of every 255 people, type 2 diabetes, and nerve damage. And the really uncommon, serious side effects that constitute risks of using a statin include muscle inflammation, which occurs in fewer than 1 out of 10,000 people, and liver damage. Now, some of those things sound awful, but would you rather have one of those, or would you rather have a heart attack? That's the kind of balancing of benefits against risks that you have to do in considering a statin drug. That's what you have to do with everything. Next, you need to know what to expect in terms of how long you would take a statin drug. You see, statin drugs only work while you continue taking them. They aren't like antibiotics that you take for a while and then stop. So most people who start a statin drug will likely take it for the rest of their lives. Of course, you could do other things that make it such that you no longer need the statin drug. It's just that the majority of people who need a statin drug do not do or will not do those other things. The alternatives include drastic diet and lifestyle changes. And unfortunately, our society is one with a quick fix mentality. Many people have the misconception that they can take a statin drug instead of adopting good diet and exercise habits. That's not the way it works. The higher your heart attack risk, the more you need to do everything possible to lower your risk. But if you're on a statin drug and you want to stop it, you don't just stop it suddenly. You first do other things that can provide some of the same benefits as a statin drug. First, you adopt a 100% plant-based diet. It's low-fat, high-fiber, and low sugar. I gave you 3 videos on this. They were videos 169, 170, and 171. Additionally, you start exercising regularly in a way that benefits your heart. I gave you 2 videos on that. They were numbers 172 and 173. Third, you take all the vitamins, minerals, supplements, and herbs that can lower your risk for a heart attack. I gave you videos on all those things too. They were videos 174, 175, and 176. And depending on how early you are in your postmenopause, you might consider taking HRT. Then you might lower the daily dosage of your statin a bit. Alternatively, you might switch to a different statin drug. As you can see, there's a lot of things to do. But the statin drugs are not the only non-hormonal way to mend a broken heart. The second category of non-hormonal medications for lowering your risk of heart attack is aspirin. And it does this by thinning your blood just a bit. Most people take 1 baby aspirin daily. The most common side effect with aspirin is stomach upset. The most serious is gastric bleeding. And you shouldn't take aspirin if you already take any of the following medications: other blood thinners, any of the SSRI antidepressants like Prozac, Zoloft, or Paxil, any non-steroidal anti-inflammatory drug like Anaprox, Motrin, or Advil. But you're still not out of options, because there's one more non-hormonal medication category for mending a broken heart. The third and last category of non-hormonal medication for lowering your risk of heart attack is the antihypertensive medications. In other words, these are the medications for reducing high blood pressure. As you've seen in the long list of risk factors for heart attack numerous times now throughout this unit, high blood pressure is one of the factors that increases your risk of heart attack. And high blood pressure is a very common problem. It causes no symptoms until it's too late. So don't assume you'll know if you have high blood pressure or need a blood pressure lowering medication without checking your blood pressure. There are a bunch of medications for high blood pressure. So you can usually find one that works well for you. And they don't cause a bunch of bothersome side effects. Definitely, they don't have any side effects that outweigh the benefit of lowering your blood pressure. So there you have it. 3 different categories of non-hormonal medication options for mending a broken heart. You know, that song never tells you how to mend a broken heart. All it does is ask questions about how to mend a broken heart. Aren't you glad you don't have to rely on that song to prevent a heart attack? And that brings us to the end of your non-hormonal medication options for preventing a heart attack. It also brings us to the end of the options, but not to the end of the heart attack unit. We still need to address 4 other diseases that are closely related and often present with a high risk for a heart attack. They are stroke, blood clots, high blood pressure, and diabetes type 2. So I'll address each one of those in the next 4 videos, and then we'll be done with the entire unit on heart attack. You'll know how to do everything possible to prevent one. Okay, so you know what to do. Schedule consultations at menopausetailor.me. Subscribe, follow me, and I'll see you in a week. Bye.